A 62-year-old man with chest pain waits 6 hours in one emergency room. 40 miles away, a 62-year-old man with the same chest pain is examined within 4 minutes by a cardiologist who already has his lab results pulled up on a tablet before he's finished sitting down. Same symptoms, same country, same disease. The only difference between them is the number sitting in a bank account neither doctor can see, but somehow every doctor in the room already knows. Medicine likes to present itself as blind to money. White coats, waiting rooms, the same diplomas on the wall, the same oaths sworn at the same kind of graduation. But healthcare in America runs on a hidden ladder, and where you stand on it decides how fast you're seen, how long you're heard, and whether a doctor remembers your name or your chart number. It's not written down anywhere. No hospital posts a price list for attention. But walk through the tiers in order, from $0 to $50 million, and the ladder becomes impossible to unsee. You start with no insurance and about $400 in checking. The emergency room is your primary care doctor now, whether you like it or not, because it's the only door required by law to let you in, no matter what's in your wallet. You walk in with a fever that won't break and a cough that's turned into something else, and you take a number like you're ordering deli meat. The waiting room has 60 people in it, the chairs are bolted down, and the television is mounted to the ceiling playing a rerun nobody asked for. The average wait to simply be seen by a doctor in a high-volume public ER stretches close to 4 hours, and that's before a single test gets ordered. Your phone battery dies somewhere around hour 2. When a nurse finally calls your name, she's managing 18 other patients tonight, moving in the clipped, efficient rhythm of someone who hasn't sat down since her shift started. The doctor who eventually sees you spends an average of 8 minutes in the room, most of it looking at a screen. He orders the cheapest test that rules out the worst outcome, not the best test that explains what's actually wrong, because the hospital already knows there's a decent chance this bill, often $1,200 to $3,000 for a basic ER visit, goes straight to collections in 90 days. You leave with a discharge sheet, a prescription you might not fill because it's $40 out of pocket and rent is due Friday, and instructions to follow up with your primary care doctor, a doctor you don't have and can't afford to find. Nobody calls to check on you tomorrow. Nobody has your number. If the fever comes back at 2 a.m., you start this whole process over from the parking lot. Move up to standard employer insurance, a $30 copay, and a primary care doctor whose practice quietly carries 2,400 patients on paper. This is the tier most working Americans actually live in. And it feels like an upgrade, because technically it is. You have a name in a system now, a portal you can log into at midnight, a doctor who has at least met you once before and has a folder with your blood pressure history in it. But that doctor is booking 3 appointments an hour to keep the lights on under thin insurance reimbursement rates, which means your visit is scheduled for 15 minutes, and studies consistently show it runs closer to 11 before productivity numbers start looking bad on a spreadsheet somewhere upstairs. You've rehearsed your list of symptoms in the car because you already know you'll only get to explain 2 of them before the knock on the door signals the next patient is waiting. Getting an actual appointment for something non-urgent takes an average of 26 days in major metro areas, sometimes longer during flu season. So if it's not an emergency, you wait, and if it becomes one while you're waiting, you're back in that ER waiting room from Tier 1, taking a number again. The doctor is good. She went to a real medical school, and she cares, genuinely. She's just stretched across 400 other people who also think of her as my doctor, and there are only so many hours in a day to be everyone's. Upgrade to a strong PPO plan through a good employer. Roughly $12,000 a year in premiums split between you and your company, and something shifts in a way you feel almost immediately. You can pick specialists without waiting on a referral to crawl through the system. You can call and get a next week appointment instead of a next month one. Your primary doctor's panel is closer to 1,500 patients instead of 2,400, so visits stretch to 18, sometimes 20 minutes, and you start noticing the doctor actually reads your chart before walking in, instead of scrolling through it while asking your name for the 3rd visit in a row. This is the first tier where preventive care stops being theoretical. Annual physicals with real blood work panels, a doctor who flags a borderline cholesterol number before it becomes a cardiac event instead of after. It's not luxury. It's just enough breathing room that medicine starts working the way it was designed to, catching problems while they're still cheap and small, instead of catching them in an ER at hour 4 of a 6-hour wait with a bill attached. Then you cross into concierge medicine, and the entire relationship flips on its head. For a membership fee, typically $2,000 to $5,000 a year on top of your regular insurance, your doctor now caps their practice at around 400 patients instead of thousands. You get their cell phone number, not the office line, not an answering service reading from a script, their actual number. You text a photo of a rash at 9 p.m. on a Sunday and get a reply by 9:20, sometimes with a prescription already called into the pharmacy before you've finished typing a thank you. Appointments run 30 to 60 minutes because the math finally makes sense for the doctor to spend real time in the room with you instead of racing the clock. Same-day visits become normal instead of a favor you have to ask for. The waiting room, when you do go in, has 3 chairs, soft lighting, and none of the chairs are occupied. What you're really buying at this tier isn't better medicine. The science is identical to Tier 3, the same drugs, the same guidelines. You're buying a doctor's attention, undivided, which turns out to be one of the scarcest resources in the entire healthcare system, scarcer even than the medicine itself. Climb into elite concierge practices, the kind that charge $20,000 to $40,000 a year in membership fees stacked on top of insurance, and access becomes almost absurd compared to where you started. These practices cap their rosters at 50 to 100 patients total, not per doctor's daily schedule. Total, forever, full stop. Your doctor isn't managing a patient load anymore. They're managing a short list of relationships they actually remember without checking notes. You get same-day, often same-hour appointments, and a direct line that gets answered on the second ring. Annual physicals stretch to 3 or 4 hours and include imaging that would normally require 3 separate referrals and 6 weeks of waiting, MRI, full-body scan, advanced cardiac screening, all bundled into a single visit because the practice owns or partners directly with the equipment down the hall. If you're traveling and get sick in another city, your doctor is already on the phone coordinating with a local specialist before you've finished checking into your hotel room. The trade-off nobody advertises out loud. Some of these practices lean toward over-testing, ordering scans with no clinical indication just because the technology sits idle otherwise, which occasionally finds shadows that were never actually problems and sends you down an anxious, expensive road, chasing something that turns out to be nothing. At the executive health tier, the kind of program major hospital systems run for corporate leadership, typically $10,000 to $25,000 for a single full-day evaluation covering nearly every organ system, you're not seeing one doctor anymore, you're seeing a coordinated team in a single day. Cardiologist, nutritionist, radiologist, sometimes a longevity specialist, all reviewing the same file in real time in the same building instead of 6 offices that never talk to each other. You arrive at 7 a.m. in a private suite with your name already printed on the door, and by 4 p.m., you walk out with a full diagnostic picture most people wait 8 months and 6 separate appointments to assemble piece by piece. The valet parking is complimentary, the robe is heated, lunch is catered between scans. But underneath the polish, this tier solves a real structural problem, not just a comfort one: fragmentation. In lower tiers, your cardiologist and your endocrinologist almost never speak directly. Here, they're standing in the same hallway comparing notes on you specifically, which catches drug interactions and slow-building patterns that get missed when your care is scattered across a city and nobody owns the whole picture. At the very top, past $20 million in net worth, some families retain a personal physician outright, a doctor who works for one household, sometimes traveling with them, on a retainer that can run $200,000 to $500,000 a year, occasionally more once 24/7 availability and international travel are written into the arrangement. This doctor isn't juggling a patient panel at all. There is no patient panel. There's you, your spouse, sometimes your kids, and a level of familiarity with your body that borders on the absurd. They know your resting heart rate on an ordinary Tuesday, so they notice within hours, not months, when something drifts off baseline. If you're on a yacht off the coast of Sardinia and you spike a fever, they're on a plane within the hour, not a wait list stretching into next month. What you're purchasing at this altitude is time itself, the compression of "we should keep an eye on that" into "we caught that 11 days ago and it's already handled and behind us." The irony worth sitting with is that the medicine hasn't actually changed much from the concierge tier onward. The tests are similar. The drugs are the same drugs sold under the same names. What changes, tier after tier, is speed, attention, and the number of days between a symptom first appearing and someone qualified actually laying eyes on it. Lay all 7 tiers side by side, and a pattern comes into focus that has nothing to do with medical knowledge and everything to do with time. At the bottom, you wait 4 hours to be seen and weeks to be treated for something that was never going to wait politely for an opening on the schedule. At the top, someone notices you're unwell before you've fully noticed it yourself, sometimes days before the first symptom would have even registered as worth mentioning. The doctors aren't smarter as the numbers climb. That's the part that stings a little once you really sit with it. Many of them trained at the same schools, read the same journals, memorize the same diagnostic criteria out of the same thick textbooks. A cardiologist billing Medicaid rates and a cardiologist on a $300,000 household retainer can both tell you exactly what an EKG is showing. The knowledge in the room doesn't change. What money actually buys, rung by rung, is minutes. Minutes of undivided attention instead of divided attention. Minutes shaved off a waiting room clock that used to run 4 hours long. Minutes between a strange symptom appearing and a specialist's eyes actually landing on it, rather than a doctor's eyes landing on a screen showing 11 other patients still waiting behind you. Think about what that compression actually means across a lifetime instead of a single visit. Someone in Tier 1 might not get a borderline blood pressure reading flagged until it's already causing headaches, because there's no annual physical schedule to catch it early. There's only a trip to the ER once it's already a crisis. Someone in Tier 6 had that same borderline number flagged 18 months earlier, adjusted with a small medication change during a routine visit, and never thought about it again. Same body chemistry, same disease trajectory left unchecked, wildly different outcome, decided almost entirely by how many minutes a doctor had available to notice. That's the real currency changing hands at every tier of this ladder. Not better science, not secret treatments unavailable to the public, just time, attention, and how many other patients are standing behind you in line, waiting for the same 8 minutes you just used up. None of this means the system is hopeless if you're standing on one of the lower rungs, and it doesn't mean every dollar spent higher up the ladder buys something worth having. Plenty of concierge patients pay thousands a year for reassurance they never actually needed, chasing test results for symptoms that would have resolved on their own by the following Tuesday. Plenty of people in standard PPO plans build real, lasting relationships with a primary doctor who remembers their kids' names and calls personally with lab results, instead of leaving it to a portal message. Money buys speed and access far more reliably than it buys wisdom, and a rushed 8-minute visit from a doctor who genuinely listens can still outperform an unhurried hour with one who doesn't. It means understanding which tier you're on changes how you have to advocate for yourself inside it. Showing up with your 2 most important symptoms already prioritized, pushing for that annual physical even when it feels like a hassle to schedule, treating a 15-minute appointment like the limited resource it actually is, instead of assuming your doctor will find the time no one gave them. The latter is real, and it isn't going away soon. But knowing exactly how it works, tier by tier, is the first real advantage available to anyone standing anywhere on it. If this opened your eyes to how differently wealth is treated, hit like and subscribe for more.